Okay, Bismillahirrahmanirrahim. Thank you to Dr. Hanis, the chairperson. Assalamualaikum warahmatullahi wabarakatuh, and good morning to all attendees. I am Tuan Siti Mastazliha binti Long Tuan Kechik, the postgraduate student and also the research assistant for the project. Also, thank you to Prof. Dr. Kamar Imran, who encouragingly giving me this opportunity instead. Okay, today we are going to talk about digital health innovation, mHealth for stroke caregiver support, the CaknaStrok app. This presentation represents a team-based research initiative led by the University of Science Malaysia and also under leadership of Professor Dr. Kamaru Imran Musa. Okay. Stroke remains a major public health issue in Malaysia. In 2021 alone, stroke accounted for more than 21,000 deaths and representing nearly 13% of total mortality and making it the third leading cause of death nationally. And beyond this mortality, stroke leaves many survivors with long-term disabilities, resulting in heavy dependence on the caregivers. Studies reported that caregivers were dealing with major challenges in caring for their stroke patients. The challenges such as the high emotional stress, lack of knowledge and information sources. They have the difficulty managing medicine due to the lack of the knowledge, limited rehab access, which all then contributes to the poor recovery outcomes. And what they were seeking, what the caregivers were looking for is a tool or a platform that could boost their quality of care. And due to the COVID-19, the boom of digital reliance was significantly increased. Hence, the idea of digital approach for stroke care came up as well. However, in Malaysia, the availability, the content, the cultural relevance of such apps will remain unclear. And there are narrative study and also another study on systematic review of stroke mobile apps in Malaysia once again prove that all along our local stroke survivors and caregivers were and still currently relying on generic and non-localized mobile app, which may obviously are going to negatively affect the usability, the adherence, and also ultimately affect the ultimate recovery outcomes. And due to the absence of such app and considering those challenges faced by caregivers, as I mentioned before, the objective of CaknaStrok project was to develop an evidence-based and also a culturally relevant digital interventions to support caregiver throughout the stroke recovery journey. The app was targeted to focus on stroke prevention. We are focusing on the rehab guidance. We focusing on the patient self-management and also for the caregiver education. All of these are to address both clinical and also psychosocial needs for both stroke patients and also the caregivers themselves. And originating from the international research project titled the Scalable Solution for Supporting Informal Stroke Caregivers in Malaysia, Systematic Development and Feasibility Study. This research was funded by the Newton Ongkod Omar Fund, by Kementerian Pengajian Tinggi and also Medical Research Council in 2019. A solid research team was established with strong collaborators and also with partnerships locally and internationally. The development of CaknaStrok followed a structured, stepwise journey, a research to implementation pathway over several years. In 2020, the project was systematically examined. We examined the challenges, we examined the unmet needs of informal stroke caregivers in Malaysia. That proceeded in 2021. The findings from this study highlighted a critical gap in post-stroke home care, particularly the absence of a structured and culturally relevant digital support platform, as I mentioned before. And also this led to the co-development of evidence-based educational modules in 2022, guided by the MRC framework. And this involved the caregivers, we involved the stroke survivors, we also involved the multidisciplinary healthcare professional. A series of stakeholders and workshops and intervention modeling phase were conducted. Hence, in 2023, these modules were then translated into a mobile app through collaboration with Dr. Us, our developer and partner company, and with strong emphasis on the usability, the data security, and also the multilingual accessibility. In 2024, we conducted usability testing and field validation of the CaknaStrok app in selected hospitals in Kelantan and Terengganu. Kelantan, we involved the HPUSM and also HRPZ, and for Terengganu, we involved the HNZ. These all are to assess its feasibility for real-world use. We adopted a multi-layer validation approach. First, user-accepted testing, or the UAT. We carried out this with the involvement of the key stakeholders and the technical development team to ensure that the app features function as intended. And second, we evaluated the quality and the appropriateness of the app content using an established psychometric tools, named Face Validity Index, the FBI, and also the Content Validity Index, the CVI. And these assessments were conducted and validated by selected experts to ensure that everything that we provided in the app are clinically accurate and also relevant. We then conducted a formal usability study involving 40 app users using the SCAMAS questionnaire, which Alhamdulillah overall demonstrated a good overall usability score. And all the user feedbacks and also all the qualitative comments were systematically collected, and we used to refine the app before proceeding to pilot testing of the complete version in 2025. We expanded the project into a multi-state feasibility study across Peninsular Malaysia, also Sabah and Sarawak. And this phase involved 1 month of app usage and was evaluated using the Modified Mobile App Usability Questionnaire, or the MMAO. Alongside, we also conducted a focus group discussion, the FGD, and also the in-depth interview, the IDI. And with consistently positive feedback across all these phases, the project culminated in the national launch of CaknaStrok on 18 September 2025, where the ceremony was held in our PPSP. CaknaStrok is an app that evolved based on evidence, based on the user feedback, and for the real-world implementation needs. It provides structured educational content. It provides rehab and exercise guidance. We also provide the health facilities information as well as emotional and psychosocial support. And all contents are developed based on clinical evidence and designed to be accessible to caregivers with varying levels of health and digital literacy. At its core, CaknaStrok provides a structured step-by-step guidance to ensure that the caregivers can deliver effective care at home. And the app features a series of educational modules. We covered the nutrition, the positioning, the hygiene, speech and motor exercises. We also have emotional management and also medication adherence. Each module integrates micro-learning content. We provide the visual demonstrations and also using the simple language to enhance understanding and also the retention for the users. The emphasis is on practicality. We want to support caregivers in daily decision-making rather than overwhelm them with medical jargon. From the technology readiness perspective, CaknaStrok has achieved a level suitable for real-world use. The technology readiness level, currently CaknaStrok is at the level TRL 7, that showed that we are good to be in real operational environments with verified usability and also impact potential. CaknaStrok is also aligned with several of the United Nations Sustainable Development Goals, the SDG. CaknaStrok contributes to SDG 3 by improving access to rehab guidance and caregiver support with the aim of reducing preventable disability. We also support the SDG 4 by enhancing health literacy among caregivers and the patients. And from the innovation perspective, the app also aligns with SDG 9 by contributing to digital health development and strengthening healthcare delivery infrastructure. And finally, by providing inclusive access to stroke care support across diverse geographic and also socio-economic settings. We address the SDG 10 on the reducing of inequalities. CaknaStrok is designed to be applicable across multiple levels of the healthcare ecosystem. At the community level, the app empowers informal caregivers by providing the accessible guidance. We provide the structured learning and emotional support, which can improve the caregiver confidence and also self-efficacy, which are the critical factors in patient recovery and also caregiver well-being. And at the clinical level, it functions as a digital tool that complements conventional rehabilitation and also the discharge education. Healthcare professionals may use it to reinforce caregiving guidance, the support adherence, and also to monitor the recovery progress beyond the hospital setting. And at the policy level, CaknaStrok is aligned with the NDBH, the Malaysia's National Digital Health Blueprint, and also the Public Health 5.0 agenda, supporting the integration of digital solutions into preventive and also rehabilitative care. The initiative also reflects a quintuple helix approach. We brought together the academia, we brought together the healthcare services, the industry partners, the government, and also the community, the stroke community themselves. And we're also pleased to inform that all intellectual property, the IP related to CaknaStrok, is jointly owned by USM and also by Dr. S. All of these are under the Newton Ungku Omar Fund research agreement. And this includes the educational content, the app design, and also the system architecture. Trademark registration is currently in progress, with additional copyright and patent protection being explored to ensure the ethical governance, the sustainability, and also the readiness for future collaboration and commercialization. Despite encouraging process, several challenges remain, and this includes sustainability and long-term governance. We were and are being held back due to the funding and also resource constraints. We also experience limited in-house technical expertise. I mean, we are well equipped with healthcare, with medical and clinical experts, but we do lack in the technical, the software engineering parts. We also face the complexity of integrating the digital tools into government healthcare, unfortunately. But additionally, while feasibility data has been collected, due to the resource limitation, the analysis is still ongoing. But moving forward, our focus includes institutional adoption in our very own HPU USM. And inshallah, currently we are planning to make the CaknaStrok app as the official app for the unit rawatan stroke in HPU USM. Even though currently we still at a very preliminary and engagement phase for now, but we are hoping for it. And we're also looking forward to enhance the app features and the content depth. And we would like to also explore the prospect and perhaps also the use of artificial intelligence. Maybe chat box will be included in the app. Other than that, we're also preparing for the integration with the existing health system. And in parallel, discussions on sustainability and commercializations are ongoing with the aim of ensuring long-term viability without compromising accessibility. This project is the result of a multidisciplinary team effort involving the researchers. We have clinicians, also technical collaborators. On behalf of the team, and as a part of it, I would like to acknowledge the contributions of all team members who have supported the development and the implementation of the CaknaStrok. Gladly, I still have a couple of minutes, and I would like to share the user's review for the experience in using CaknaStrok.
Apa pendapat cikgu berkenaan dengan CaknaStrok apps?
Bagi saya, sebab saya macam baru lagi lah untuk ada nak kena jaga orang stroke ni kan. So kat sini memang berguna lah untuk saya sebab saya boleh keep track bagai-bagai. So ada juga stress assessment kat sini. Bagus lah sebab kita rumah sakit, nak menjaga rumah sakit ni bukan mudah. So ada kat situ dan dia pun salah satu risiko juga untuk saya lah untuk mendapatkan stroke. Kat sini saya tengok lah kat guide ni memang ada banyak video info berguna daripada video tu.
CaknaStrok ini bagus, detail dan banyak pengetahuan kita yang kita boleh tahu akan menjaga pesakit stroke di hospital, di rumah, cara penjagaan, keperluan, pemakanan, tekanan, stres kita, luka-luka pasien. Daripada sini tentang pentingnya terapi selepas stroke, penjagaan diri kita, mental kita.
Ia boleh banyak sangat membantu kat diri saya. Tak tahu apa-apa untuk pesakit stroke lah. Kita pun ada tu tiba-tiba pun dia tu mari sakit apa semua. Lepas tu dalam tiba-tiba tu ada tu kadang kita akan jaga ni. Tak tahu nak buat apa. So untuk app ni bagi saya membantu sikit untuk kita yang clueless. Tiba-tiba kalau jadi gitu, kenapa kita kena buat? Ia macam membantu sangat lah bagi orang yang tak tahu apa-apa.
Untuk apps ni memang kata banyak juga membantu dari segi kita nak tahu cara penjagaan pesakit stroke tu. Sebab ni kali pertama untuk menjaga, jadi cara tu tak tahu sangat. Bila adanya apps ni, jadi cara macam mana nak menjaga, jadi sedikit boleh kami tahulah untuk menjaga yang sakit stroke. Selain tu kami yang menjaga yang stroke ni, kami juga dapat menilai tahap tahap emosi kami, tahap tekanan kami macam mana sepanjang kami menjaga pesakit stroke ni.
Okay, these are the feedback from the users, which highlights the practical value of CaknaStrok in supporting caregivers during the recovery process. And this experience reinforce the importance of developing the digital health solutions that are grounded in real-world use needs. And in conclusion, here also I would like to show just a brief showing a review of the apps. We can see this is the home screen, and here are the video guidance that we provided by our experts, and also the stroke management at home, or how they want to change patients' needs. We also have Barter Index to monitor the progress of the patient stroke. Other than that, we also provide DAS21 to evaluate their mental health level, and also we provide the health facilities information and many more. In conclusion, CaknaStrok, we represent an evidence-based community-centered digital health innovation and a very strong potential for institutional integration. While further work is needed, the foundation has been established for next phase of development. And as shared, CaknaStrok is now available on both Google Play and also App Store. Everyone could scan these QR codes and also install to check out the apps more. And I'm lucky today because not only Prof. Kamaru Imran himself is here, but also my supervisor, Prof. Hafiz, and also co-supervisor, Prof. Jafri, also attending these sessions. And thank you very much for your attention. We welcome any questions or comments. Thank you.
Thank you very much, Ms. Siti, for the very impactful apps. I think this is very timely that we are facing the aging society in Malaysia. So I would like to open the floor for questions. You can you can open your microphone, or you can also unmute your microphone, or you can also shout your questions in the chat box. Okay, to keep the ball rolling, perhaps I can start. Ms. Siti, can I ask whether there's a feature to encourage the caregivers to interact with each other, sort of like a support group platform?
Okay, thank you, Doctor, for the question. Initially, we did plan to have a features of a community online engagement for the stroke caregivers. However, because of we kind of ranking of features, which one is more important first to be input due to the budget, and then this has been pushed back a bit. But we have an alternative. We actually gather the stroke caregivers currently on our official Facebook for any engagement with each other. Thank you.
Thank you, Ms. Siti. We have another question from Dr. Wan Nazatoshima. How do you plan to sustain the caregiver engagement with the app over time?
Sustain the caregiver engagement with the app over time. Like any other app, we believe we have to keep being relevant, meaning that everything that we provided in the apps, the contents, has to move parallel with the progress by time. For example, we are planning to make sure that the information that provided in the app are current and also beneficial for the caregivers' needs. Currently, the apps, what we have, all are new contents, meaning that, for example, the video guides and also the expert talk are all recently being recorded. And perhaps in future time, we are going to make an update regularly to keep the relevance. Thank you.
Okay, thank you, Dr. Siti, Ms. Siti. Is there another question from the audience? All right, so there's a suggestion from Dr. Tuan Arifin. He installed the app already, and when he opened the app, the default language is English. Maybe the default can be changed to Bahasa Malaysia, or maybe can add Tamil language.
Okay, thank you, Dr. Arifin, for the question. Actually, when you open the app, there is a button up there that can, first thing first is to choose our language. And the apps is currently available in Bahasa Malaysia, English, and also in Mandarin. Tamil, we do have the plan, and perhaps in future update, we are also going to make it available. Other than the first page, when you download the app, you also can change in the Tukar Bahasa. Here just change the English, Bahasa Malaysia, and also in Mandarin. So we provided that in the app. Thank you.
Okay, so we still have time, so perhaps I can invite for a couple more questions. All right, so this one question from Dr. Yvonne. Great and helpful apps, and of course, very impressive presentation, Ms. Siti. What advice would you give to individuals who are interested in developing a mobile application for medical care?
Okay, thank you, Doctor, for the question. To say that advice, okay, I can only be advised as the student or as the research assistant level. As advice is first, we have to make sure that whatever that we are doing is needed and necessary for the community and also for the field that we are using. But however, if doctor would like to hear a more relatable advice, perhaps Prof. Kim can also join in because the hard work and also the hard part of it is on Prof. Kim.
Okay, thank you, Ms. Siti. And the supervisory team has already extended invitation to join them. Yeah. Okay. Calling for last question before we end the MRP.